Hey guys, this is Dr. Ince. I'm here today talking about something that is a complication, if you will, of COVID-19 that all moms with children still at home should be thinking about.
Hospitals are now reporting cases of an inflammatory syndrome in children that may be linked to the coronavirus. The good news, doctors are learning more about what causes the illness and how to treat it. Stephanie Whitfield explains.
Doctors in Europe, New York, and now Houston are noticing the same trend. Some children are getting sick several weeks after COVID-19 peaks in the community. The illness looks similar to Kawasaki disease, but doctors now say it's something totally different, a disease called Multisystem Inflammatory Syndrome in children, or MISC. There have been several confirmed and suspected cases at Texas Children's Hospital, and under 20 suspected cases at Children's Memorial Hermann Hospital.
We think that what's happening is that the immune system is overreacting to the COVID-19.
So multisystem inflammatory disease in children was first popped up in the UK in April 2020. So we know little about it, like a lot of stuff with COVID, but what we're in this information may be somewhat obsolete in the next month or two, but we'll let you know. I'm going to let you know today what we're seeing so far. So we typically have seen a rise in COVID, and then a couple weeks later, we'll as a rare complication of COVID, we've seen something called multisystem inflammatory disease in children, which is basically what is it? It's an abnormal immune response to COVID-19. So what are we seeing in patients with, let's call it MISC? What are we seeing in patients with MISC? So usually it's kids that are anywhere from 9 to 11 has been the average age, but really anyone under the age of 21. And it's typically not people or patients with acute COVID. And so typically most of their PCR, which is the nose swab test that everyone loves to get, the nose swab test has been negative in most of the patients. The antibodies have been positive in most of these patients. So typically it's exposure to COVID, sick or not sick, and then sometime later, maybe a few weeks later, develop this abnormal immune response to something that happened weeks ago, so potentially to the antibodies themselves, or the body recovering from COVID as a delayed immune response. We're still learning a lot about it, but typically what we see in these kids is fever in all of them, so persistent fever. So look in your kid, for fever, typically over 100.4 is characterized as a fever. Usually it's a prolonged duration in these kids, so can be from 3 to 5 days of persistent fevers. Most of them, if not all, have some kind of GI symptom. So, Mom, my belly hurts, or I'm vomiting, or I have diarrhea. Most of them are going to have some kind of GI complaint. Some of them may have a conjunctivitis, so come to you with a red eye, or maybe you just kind of notice it and they didn't even notice it. Maybe some swelling in the hands or feet. Sometimes there's what we call mucocutaneous involvement, so maybe you notice the swollen foot or rash on the foot, or swollen red tongue, or swollen red lips, something like that, that is similar to something that we call Kawasaki's disease, where people do present with lymph nodes, swollen red lips or tongue, a swollen or a red eye, symptoms like that, also with fever. So this abnormal immune response has seemed very similar to another abnormal immune response, which is Kawasaki's disease. And they're treated somewhat similarly, but multisystem inflammatory disease in children can be a lot more severe if it goes untreated or is not caught early. most of these kids can potentially go into shock, though most is a very small caseload right now. So we've got a small case number because this is a newer diagnosis, so people are becoming aware of it, usually when kids are sicker. And so if we're picking it up more, maybe over time, we're going to be seeing some less severe forms of this. But things to watch out for mostly is the symptoms I mentioned. Fever for sure, maybe nausea, vomiting, abdominal pain, may kind of look like appendicitis, and a lot of these kids maybe will have some gut inflammation on imaging whenever they go in. Rash, red eye or conjunctivitis, swelling or redness in the tongue or lips, or maybe some swelling in the hands or feet. So those are maybe sometimes, in some cases, a headache or I'm really, really tired. Though COVID-19 itself as an acute illness, most kids will not have any symptoms or very mild symptoms. Some kids may have a fever with a little headache and mom, I'm tired, kind of thing. That's more an acute COVID, and that typically has affected babies under a year old. This is more, and so does Kawasaki's disease, very young children typically. So multisystem inflammatory syndrome in children typically affects a little bit older children. And so older kids, young adults, teens are suspected more so in those children. So what do we do? If you come in as providers, if you come in with those symptoms and the kid looks great, then your provider may or may not send you home maybe with some lab testing, maybe a COVID test, and may do a couple markers for inflammation in the blood. Typically, who needs to be hospitalized are kids that the labs come back maybe really abnormal, or the kid's just sick, really sick. So it's up to the discretion of your provider what kind of testing is done and when and what point these kids get hospitalized. But can be a pretty severe illness in children if it goes undiagnosed. And so keep a lookout, because moms are on the front line, I know as a mom myself, of catching things in kids. And a lot of the cases that have been detected have been mom noticing, why are your feet swollen and you've got fever, and I'm noticing you know, red eye. I read about this thing called MISC. Let's take you in to the local health department and get you checked out. So raising awareness is really important to me about it, just so we can start picking up more cases of this, and so we can start learning more about it. It's also very interesting because as we're moving forward, learning more and more about antibody testing, and this is a very important case for antibody testing. Typically, PCR has been kind of the most important, which is the fun nose swab. But antibody testing, which is typically done by a finger prick or blood draw, is becoming pretty important, because we're learning that about immune responses like MISC after COVID hits. So talk to your doctor about it if you think that your child may be experiencing any of these symptoms. And so stay informed and be healthy.
Thanks for watching this video. Yeah, just eat whole food, plant-based. You don't have to count calories. Get rid of the processed junk. This is a Diagram Caldwell Esselstyn worked with Bill Clinton and Samuel L. Jackson to reverse cardiac blockages.